Welcome and welcome, everybody. Thank you so much for joining us today for today's exciting webinar, and we are thrilled to have you all here. I am Huda Rashid, fourth year medical student at Dow Medical College. I also serve as an associate in outreach department in DMS. Before beginning our today's session, I would like to give you guys a quick, brief introduction about DMS. So, Dow Medicine Society was founded in 2022 under the mentorship of Dr. Shaheen Bhatti, Dean of Medicine at Civil Hospital Karachi. So, what's the aim of Dow Medicine Society, right? So, Dow Medicine Society basically aims to equip students at DUHS with adequate learning opportunities to become better clinicians. And it also provides medical enthusiasts, basically internal medicine enthusiasts, to showcase their academic strengths. Tonight, we have our special guests, Dr. Hashri Awan and Dr. Naman Khurshid. Before proceeding, I would like to give a brief introduction of both of them. Dr. Naman Khurshid, an incoming PGY1 at St. Vincent Hospital in Emergency Medicine, and Dr. Hashir Ali Awan is also an incoming PGY1 at Western Brother Medical Center, New York, in Emergency Medicine. Without any further ado, I would like to hand over this virtual stage to none other than our President, Amna Iqbal. So, Amna, over to you.
Hello, thank you so much, Hada, for the warm welcome. Let's start the session. So basically, my name is Amna Iqbal, and I'm a huge honor to serve as the president of DMS and starting this webinar series. I welcome you all in episode 2 of the match cycle, which is basically the blueprint how to get matched into your dream specialty. Today, we are bringing the emergency medicine episode, and congratulations to both of our speakers who got matched into the emergency medicine, which is not just very competitive, but it's very hard to match in a non-US IMG as a non-US IMG doctor in one of the most competitive specialities. So thank you so much, Dr. Hashir Ali Awan, to agree to speak to us. Dr. Hashir, are you there?
I am, Amna. I hope I'm audible as well.
Yes, you are audible. Huda, can you please keep changing the slides while I'm speaking? Can we go to the 4th slide, I guess?
Yeah, I am.
Okay, we're going to start the session. Zainab, can you please help her while for changing the slides?
Amna, you, I guess, continue. There is some issue. I'll check into it.
Okay. Okay, sure. So, Hashir, let's start with your emergency medicine journey. First of all, let's talk about how and when did you decide to pursue emergency medicine specifically? Because once you pick one specialty, you know you are going to do it for the rest of your life. So, what inspired you to choose emergency medicine and to work as an emergency medicine doctor? And then we're going to talk about how to get married and stuff like that.
There are two aspects to the selection behind emergency medicine. The first one is, of course, interest and your intrinsic motivation to do it. I was part of FRIP in Dow, and it really gave me a very good sense of how emergency care really works and how you have to step up in areas where people are unwilling to step up and unwilling to take action. So I was really happy that during my experience at FRIP, I got this understanding that I was willing to take action during stressful and during more pressing times. But other than that, emergency medicine is also a lifestyle choice. A lot of people who do emergency medicine If anyone has been following it, they know that it's a very high burnout specialty. It's a specialty which has a very, very high burnout level. There are a lot of physicians who don't want to do emergency medicine because of the amount of stress it provides, because there's a little bit of career instability as well. So most of us, when we look at ourselves, let's say 5 years down the line or 10 years down the line, we do imagine ourselves as attendings, and attendings don't work. That's the kind of thing that we have in our head, that we'll earn money, we'll have a good amount of money, but we won't work. But in emergency medicine, there is a expectation that you will be doing nights, you will be doing weekends, you will be doing holidays, even during your attending phase of your life. You'll definitely get paid more, but there's an expectation that attendings need to be on ground. So it is a lifestyle choice as well. So if you are someone who likes shift work, you are someone who, when their two steps are inside the hospital, wants to be completely in the hospital, and when two steps are out, you want to be completely off. That's the kind of specialty that emergency medicine is. It's a good from a financial perspective, it's a good career, because there are a lot of opportunities that are now springing up. But again, it's a big lifestyle decision that you have to take. It's not even close to family or internal medicine when it comes to lifestyle.
Hmm. So basically, the tough work-life balance, and I think the prep helped you to make the decision, right?
Yes, it's just what I prefer at the end of the day. My personal, very, very personal preference.
Mhm. Okay, so let's talk about the second aspect. Can you please change the slide? I think there's an issue in changing the slides. Let's talk about the pre-residency journey. So basically, once we get into med school, we see, okay, we have to go to the US and we pick IM. We be like, okay, we have to go to the US, we pick IM and be like, okay, we're gonna match and have a happy ending. So when we talk about the pre-residency journey, what key milestones do you feel was unique to you that you be like, okay, I'm gonna think out of the box and I'm gonna take that risk? So can you please talk about that also? Because there are many people who are going to work in an organization, but not everyone's going to
Mhm.
think like that or take that risk. So what was your unique, I think, aspect, your thought box to apply for this?
So pre-residency journey is very different for everyone. I'm pretty sure when Noman will speak, his journey is very different from mine. And if I ask another non-US IMG who matched last year from Dow, was from batch of 2015. So and Amna, you remember we interviewed him together in Ataur Rahman Hall, Dr. Tahir Shahzad. So Dr. Tahir is completely, he has a different journey. He has a different career pathway. So I think pre-residency journey is very personal, very subjective, but pre-residency journey has to be very aligned with what you want to do. I do not believe that if you are in third year, or if you are older than third year, that you should be directionless. You should have a much better idea of what you want to do in your life after third year. I'm not saying decide and stick. I'm saying start deciding. So pre-residency journey, I think for me started also around third year, when I said, okay, I want to prioritize internal medicine and emergency medicine. But this part of me was very interested in surgery, but hated the surgery lifestyle. I did not want to be in the hospital all the time. I did not want to, cut people open all the time. And I wanted a little bit of family and, more people involved in my life, and just not leave everyone and be at the hospital. So I decided on a balance between the two. So I'm sure Numan will agree that emergency medicine is the only medicine field that is closest to surgery. There is no other field that is as close to surgery. In fact, when it comes to emergency medicine, हमारा जो main competition है, like even in the US, the main competition that happens between ER residents happens with the general surgery residents, not internal medicine. With internal medicine, we are with cool buddies. The main the main competition occurs with general surgery. So if you're someone who's interested in surgery but does not want the surgery lifestyle, wants to do procedures, wants to, be there for the first 5 minutes of someone's healthcare, then I definitely feel emergency medicine is important to you. So my pre-residency journey was a lot of exploring and understanding what I like and what I dislike. This also means that when I went for observerships and when I went for electives, I was, at least I had one eye out for trying to get some amount of experience that gave me that exposure as well. Maybe I liked emergency medicine in Pakistan, but when I went to the US, I did not like it. But I ended up getting that exposure and I ended up understanding better and making a more informed decision. The worst thing that can happen to you is you sign up for something you don't know. So I would say explore, get to know more.
Great. So let's talk about when we talk about the pre-residency journey, let's talk about the timeline also. So we take the steps, some take in third year, some take in fourth year. Again, it's very personal. So for you, what was your timeline going for the step one, step two, and when did you go for the US clinical experience? Again, it could be variable from person to person, but what was yours timeline if you want to walk us through that also?
So my step one was end of final year. I did not want a deficit. I did not want a lot of days that I wanted to cover later on. So I just took around 2 to 3 weeks off, 2.5 weeks off, and I just gave my step one because step one was pass fail. I wanted to get done with it. And that was December of 2022, like December of final year at that point in time. After that, we had our final year profs. I went for electives and I went for observerships. I had not done step two at that time, although I would now recommend people to try and give step two before they go for electives, because then you can also give step three while you are there. So I did not qualify for step three because I hadn't given step two. I wasn't certified. So my electives were somehow like this, that after final year, I did one elective at UIC, which was in internal medicine, infectious diseases. Then I went to Augusta University, and at Augusta, I did anesthesia and critical care for for 4 weeks actually. I did that. The reason why I selected anesthesia and critical care was A, because that was the only observership available to me at that time. And B, I knew that it had some overlap with the fields that I like. It had overlap with internal medicine's pulm crit care, and it also had emergency medicine critical care overlap with it. So I knew I could use that experience somehow in a better way. While at Augusta, I networked a little bit and I spoke to the emergency medicine physicians there who very kindly agreed to let me observe. That is not an official program, but they agreed because I was already there in anesthesia. So they had done the vetting, right? They knew that this person is not someone who's just coming in from nowhere. It's because this person has already been accepted as an observer at the anesthesia department. So that allowed me to gain some experience in the ER. That alone, those 2 week duration observership, which was 10 shifts. So 2 weeks, I took 4 days off. I was given 4 days off, and I did 10 shifts while in the ED. And one of those shifts was also a flight medicine shift. So these 10 shifts allowed me to not only gain exposure, but also gain LORs, which will come later on in the ERAS CV. After which I went to New York. In New York, I was supposed to do a vacation, but I did not like wasting time. So I just did a 2 week outpatient observership, which helped me in my internal medicine application as well.
That's great. So we talked about you worked in different specialties like anesthesia. So how do you think anesthesia was helping you in getting matched in EM? Was there any connection, or do you think it was out of the box, but you tried to make a connection?
It's definitely close. So anesthesia, especially in level one trauma centers, especially in academic centers, anesthesia and ER do work very, very closely because intubations, the more complex intubations, especially when you are sedating someone, nerve blocks and everything are done by anesthesia, especially when there are a 24/7 anesthesiology residents present. So I definitely feel there was an overlap that I could build upon. And I also told my interviewers one thing, that the person that I was working with in anesthesia was a critical care physician. Now, this critical care physician is where, it becomes very, very similar to ER. ER does deal with critical care patients very, very frequently. It does deal with ICU patients very frequently. So I told them that those experiences and those exposures, those procedures that I did with them helped me understand why I liked ER so much.
That makes sense. So I think you skipped your house job, did you complete your house job? Because again, during house job, there are different thought process comes. Some used to say you can completely skip it and focus on your US journey. Some people say you need to get it done because it's at least an experience at your home country. So again, did you complete your house job and then follow up with the
So house job again is I would agree it's a controversial topic. Some people will tell you to skip it, some people will tell you to do it. It is not a requirement when it comes to the US pathway. So no one is going to ask you whether you have done your house job or not. No one's going to expect you to do your house job either. However, house job should be a priority, but it should be below your application. So if you're someone who's delaying step two, if you're someone who's delaying their OET and their certification and their steps just because house job करनी है, then I would definitely recommend, to prioritize your application first. You अगर आप house job start कर देंगे, आपकी application delay होगी, your cycle will go, and then you'll have to wait another year. So I would definitely say prioritize your application and apply as soon as possible. But for example, let's assume that by final year you're done with step two. After a little bit of final year, you're done with step two.
Mm-hmm.
You're done with OET and you're ECFMG certified. Now you're all ready to apply. Now you've applied in September. Don't wait at home. Don't sit at home. I would say do your house job. If it's at AKU, great. If it's at Civil, great. Just do something. You should be clinically active as much as possible. And that's what I did. I came back from electives. I started doing my house job because I did not want to stay back at home. Plus, all of you, by the time that you start your house job, are going to be 22, 23, 24, right? So you don't want to sit at home and take pocket money from your parents. You should be starting to earn yourself. So I would definitely say that even if it's house job, it's salary, right? You need to start putting yourself out there in your career and start to earn and get a paycheck. Even if it's less, you need to start getting a paycheck. It will make you feel better, and it will also give you a lot of discipline, and it will also make you value money a little bit because it will make you understand how quickly 70,000 vanish.
Yeah, I think we don't talk about finances enough, but I think it's an expensive journey and we need to take care of those aspects also. So, house job is going to help you somehow. I think not a big deal, but maybe in monthly expenses. So, let's talk about which med cycle to apply. Again, many people just pass their step one, step two, and then they're done with the USCs. Now they feel like, oh, I'm good to go for this year's med cycle, and they got unmatched and they apply second year, and then it's just a loophole journey. How do I know that okay, I'm done with step one, step two, and the USCs? This med cycle is the fit for me, or this med cycle is not fit for me? Do you have a checkbox in your mind before going for the med cycle, or you be like, okay, let's give it a try and let's just give it a shot. Now you want to apply next year because this is an expensive one, right? Setting for the match itself. So how do you know that oh, I'm fit for the match and specifically I'm fit for emergency medicine right now? So what was your take on this?
So it's very, again, there's no guarantee that this is the math cycle or this is not the math cycle. Everyone has a different journey. So don't look for objective, factors to cover. कि अच्छा ये हो गया, ये हो गया, ये हो गया. इस तरह नहीं होता. There are people who have a very good application, but they still go unmatched. That has nothing to do with whether they were ready or not. That has to do with a lot of luck. That has to do with a lot of circumstances and other factors that are involved in the process. My recommendation would be apply as soon as possible when you have done most of the things on your application. This means you have done step one, step two, OET, preferably step three, and at the same time, you have done your USCE. Don't apply without USC. I would highly recommend that. There are people who say, we have had three matches in the past, whatever years without USC. Don't rely on that. Things are changing, especially if you want to go to emergency medicine. Applying without USC is suicide. Don't do that. So I would say definitely get these things done at least. And then if you feel that, okay, I'm right fresh off the graduation cycle and I'm done with all of these things and I can apply right now, apply. Don't spend way too much. Don't apply to like 500 programs. Apply, smartly, think about it, and also keep at the same time start doing your house job and everything as well to have a good backup.
So it means like when you feel ready, just go with it, right? There is nothing like a tick box or a blueprint for it, right?
Not at all. Not at all.
Hmm. Okay. So I think can we change the slide? Tips for the ERAS application. So I think this is something we are going to stress a bit more. talk us about the different aspects of this, like the personal statement, LORs, year of graduation, what usually ERAS application looks like, and what are the tips if anyone's sitting for the math cycle this year or next year, what should they keep in their mind? Because it's April now, and if you think about September, it's like 4 to 5 months. So if anyone listening to your session right now, what tips we are going to give for the next 4 months?
So this is important again. Unfortunately, next year, emergency medicine match would not use ERAS. This has been confirmed. They would be using residency CAS, which is a new software altogether. Is this something absolutely insane? No, because gynecology, urology, and many other fields also use their own match. EM is going to now shift to residency CAS. Now, two reasons why this is good. One, it keeps the clutter away, right? आप अगर dual apply कर रहे हैं, it keeps EM away and IM away. There's no chance that they'll get mixed. Second reason why it's so good, it will save you money. ERAS costs quite a bit. Residency CAS costs less. So residency में आप CAS के पास आप double the amount of programs apply कर सकते हैं in the same. How is this bad? The reason why it's bad is you'll have to make applications. ERAS will be separate, the CAS will be separate, which to upload your personal twice, you'll have to write your CVs twice. There will be slightly different nuances to the websites as well. And the second reason why it's bad is because none of us are experienced with it. So Noman and I both applied through ERAS. So maybe next year we won't be able to help you with residency CAS because we haven't used it. So I would say keep an eye out for all the updates about residency CAS, about how EM works, and how do you keep an update about that. So I'm in the chat box. I'm going to write.
Yeah.
Just 1 second. Sim online, and then there is ASIP Nation. So these are two Instagram pages. I hope everyone uses Instagram. I would highly recommend you follow both of these pages. These are the two leading organizations of emergency medicine in the US, and they post regular updates and regular webinars for someone who's interested in knowing more about these procedures. So just follow them and keep an eye out as to how things are working. I know just as much as you do, so I'll also be following how residency CAS works. So tips for ERAS are a completely different thing because ERAS was something which won't really exist next year. But keep an eye out for residency CAS.
Yeah, that's pretty interesting. Let's see how things get unfold, and we're gonna get in touch with you if you need more details about this also. So I think let's skip to the next slide. Slide being changed. Let's talk about, okay,
Yeah.
this slide seems a bit overwhelming, but we will walk through step by step. So, okay, Dr. Harshal, let's talk about your scores for step one. Step one is pass fail, I think, so it's just a pass. Step two, what was your score if you're comfortable talking about it? How do you feel step three was an important factor? Did you take the step three or not? The research, how many number of research do we want? Year of graduation, because again, we talk about a cutoff of 3 years, connections and personal statements. I think it's a lot to talk about. Let's walk us through this step by step and let's see what further questions we can ask from this slide also.
So I haven't given step three, so I only have two steps. Step one and step two. Step one was pass fail. I gave it after it became pass fail. So I passed my step one in the first attempt. I gave my step two after final year and I got a 265. Now I know 265 sounds like a good score. It's a pretty decent score, but do I think that it mattered way too much in my application? I don't think so. Maybe in IM it did, and I got responses from programs which traditionally take 260 pluses, which is great, thank you. But in emergency medicine, I don't think it really mattered. It should not be too low, like it should not be somewhere in 220s or 230s, because that just reduces your potential, especially as a visa requiring person. But 250 plus is great. It's great. Uske baad फिर it becomes a blur. You know, you don't want to worry because you have a 258 and someone has a 255. After 250, it becomes a high score, and that's all that matters. I don't think scores mattered way too much in my EM application. Research, again, I don't think it mattered in my EM application. EM is not very big on research. EM is not also something which, prioritizes scholarly activities. It more or less prioritizes how good you are with your hands and how good you are with your procedures. So I think although I did have 14 publications in my ERAS application, it did not help me in EM way too much. Probably it allowed me to talk about, being interested in public health and how I want to do MPH, but it did not help me as an applicant, I would say. Year of graduation, I was under the 3 years, 2 years, just 1 year after my graduation. So I can't say whether it mattered or did not matter. It did, however, come up a lot in my interviews because they considered me young. You will realize how most of the emergency medicine uh, physicians, residents in the US are a little older than the rest of them, than internal medicine, than neurology. There's a reason behind that because most people want to do EM after they've done something related to EM. Most of them have had a past life. Either they are from the military, either they are someone who has worked as a firefighter, as an EMT, or as a flight nurse, or as something, something, something. Then they go to med school, then they do residency. So I would definitely say that yes, our year of graduation, even if it's 5, we are generally younger than the people who are in emergency medicine residency. And that did come up a lot in my interviews that I was younger than most of their cohort. Connections in EM, I had no connections. However, I would like to give a shout out to Dow Mentorship Program, DMP, which basically connects you with a mentor. And Dow Mentorship Program did connect us with a senior who had matched in the US. While she could not recommend us, while she could not, take her in her program, but she did help us understand the nuances a lot. She did give us a lot of advice. So since we don't have a lot of seniors in emergency medicine, every advice counts. So that was very, very helpful. So that's not a connection. I did not even get an interview from her program, but it did help quite a bit. Personal statement is extremely important. In emergency medicine, I think personal statement can make or break you. The reason why I'm saying this is because most people in the US, most program directors in the US feel that you are applying to EM because it is an easy specialty. Now, I know it sounds oxymoronic. Why do I say this? Is because 3 years earlier, EM saw a very, very, very sharp dip in the number of people that they matched. So they had around 500 positions that went unmatched in 2021. Why did that happen? Because the COVID pandemic was going on and no one wanted to be in the ER during COVID. So that caused a big dip. That made a lot of IMGs apply to EM as a secondary specialty. So they were applying to IM and EM. Now, all program directors were kind of, are on guard that, hey, if you're applying to us just because you feel you'll get in easily, then don't apply. And that is something which is very fair to say that if you're applying to my program, please be interested in emergency medicine and my program. So your personal statement is your tool show that you are genuinely interested in emergency medicine and your pathway, your life, your family, your thought process, everything is aligned with emergency medicine. The program that I matched at, this program brought up my personal statement quite a bit of times in interviews. Every single time I was speaking to an interviewer, they brought up my personal statement and they talked about it and they praised it because they said that it was very much aligned with what ER is. So I would definitely say a personal statement is extremely important. Out of all the things on this slide, I would say the most important thing is probably your personal statement.
That's interesting because we stress a lot upon step two scores. We're like, oh, I'm getting 260 and stuff like that. But at the end of the day, the thing matters is personal statement. And I think how do you write a good personal statement? We can talk a lot about it, but I think that at the end of the day, is it about experiences? You're going to talk about the more experiences you are going to get and the more you are going to write it in an effective way. Is that the truth?
It's about how you build a narrative. Your personal statement has to build a
Yeah.
story. Now, that story could be anything.
Mm-hmm.
Most people do one mistake, which is that they talk about a patient on that patient and they bring it to the end and they say, hey, this was a sick patient. At the end of the personal statement, not a very sick patient. Great. Now, this is very generic. This is very common. You need to talk about yourself. Your patient care is visible in your LORs is visible in your ERAS CV. Your personal statement is where you talk about you. How were you brought up? How do you talk to your friends? What are your interests? How do those interests align with emergency medicine? And how did your experiences make you, soul searching and that allowed you to understand that you wanted to do emergency medicine? So my personal statement basically started with the folk story that my grandmother told me in my hometown. And that started with that and it ended with that as well. So that was a narrative I was built, was brought
Oh,
up this way. And this is why ever since, my childhood, I'm preparing to be on this pathway. Now, this is something which is, different for everyone. But I would say steer away from patient care, be more personal in your personal statement.
yeah, it's who you are as a person apart from medicine, because I think scores of step
Absolutely.
3 research are going to talk to you about that. So let's
Mhm.
talk about the next slide in the application process, I guess. Okay, yeah, it's about SLOEs. So let's talk about what is this first of all. I heard this is about LORs for emergency medicine. So what is that?
Mhm.
How hectic is it? How to handle this? Please talk us about that also.
So problems with LORs are, I'm sure everyone who will grow up and everyone who will go into Dow will understand how there's a template. And that template is like you have a space, your name goes there, your batch goes there, your enrollment number goes there, and everything else is the same. So if you go to the principal and you ask her to write you an LOR, Huda, Amna, me, Noman, everyone will have the exact same LOR except for our names. Now, this is what people in the US dislike. Your LOR needs to be very personal to who you are, to someone who's, if you're good at something, it needs to highlight that. If you're bad at something, it needs to highlight that. So LORs need to be more personalized. Now, this was happening when IMGs were applying across the board, and even US physicians were applying across the board, and they were getting generic LORs. This patient, this particular observer, this particular student was great. They did this, they did this, they did this. Thank you very much. I'll be hoping to answer any questions, so on and so forth. Now, here, emergency medicine wanted to have a more objective understanding of how you were in your electives and how you were in your observerships. For that, they made up a form. Now, this form is basically a very quantifiable amount of how you are as a student. So this means how good are you at procedures? Scale of 1 to 10. You are not good, you are not excellent, you are not proficient, you are 6, 7, 8, or 9. This allows someone to directly compare you with anyone else on objective terms. Same goes for other things. How is your etiquette? 1, 2, 3, 4, 5. How is your timing? How is your punctuality? How is your knowledge? Everything becomes quantifiable. And this is very simple for ER physicians and ER program directors to then compare you with. So you can have a very high slow. And the slow has one more thing which is very important. It asks the preceptor to rank you or to give you a percentile. So they can say you are the top 25th percentile, they can say you are in the middle 50, they can say you are above 75 or above 90. This also ranks you, right? So this makes a strong, mid-strong, or a weak slow as well. This is very complicated because no other field has this. But slow is something specific. Most people do not receive interviews in ER if they don't have a slow. 95% of the programs in the US require that you have at least one slow on your ERAS application, on your application, that to be invited for an interview. So for slows, I would definitely say there are two ways to get one. One is to do an elective in the US. Okay, so this is the best option. So if you're a medical student, try for an elective in the US. If you're doing it in any way, try to get an elective. You will get a slow out of it. That's one way. The other thing is you do an observership or you do a shadowing thing like I did for 2 weeks, and you get a weaker version of the slow, an observership slow, but it still becomes a slow. So that can also be uploaded. I'm not saying it is equal to the elective one. The one in the elective is much more important, but that will still count. It will at least get you through the gate, right? And there is one other thing which I discovered during this session, and I think it really helped me. Now, if you have done an anesthesia rotation, if you've done an infectious diseases rotation, if you've done a surgery rotation, you can get a traditional LOR, which is a written LOR, or you can ask your preceptor to fill an O slow, O dash slow. That O means of service. So an anesthesia physician can also write you an an SLOE, a slow, and that can also go. So people ask, is it better to put an O slow or a traditional LOR? I definitely think you should put an O slow because it will then increase the number of slows on your application. So O slow and E slows, these are a little complicated. I understand, but there's an amazing guide on Chord's website. I'm going to write that down in the chat box as well. And that is going to help you closer to the session as well. That's about it.
Yeah, that's pretty interesting because I didn't know about it. And I was like, okay, what it is. Um, do you think quantifying the values and stuff it's a drawback when it comes to people?
100%. It's a drawback for us. We are amazing physicians. We are amazing. We are very experienced. We are very good at procedures. But in an observership, Noman and I can't stitch people up. We can't intubate people. So how can we be rated on an intubation if we did not do it, right?
Makes
So
sense.
that does, put us a little back. But how do you counter that? You counter it with your home country experience.
Makes sense. Now comes the importance of the house job. That makes
Yep.
sense. So let's talk about the other aspects, which is I think the university-based, community-based program. Can we move to the next slide, please? Application and signaling strategy. So what is signaling strategy? Because I think there's like golden signal. I don't know much about it, but let's talk about what is signals. When do you send signals, and how do you know? Okay, this is a perfect community-based program or a, I think, public-based program to send the signals. So how and what strategy did you use while doing that procedure?
So see, in internal medicine, you do have gold and silver signals, but in emergency medicine, you don't have gold and silver signals. Those are not tiered. So you get a total of 5 signals. And in those 5 signals, out of all
Okay.
the programs that you're applying, you can put 5 signals to 5 different programs, and all of them are at the equal level. So no one gets a better or a worse signal. Okay. So that's one thing. The other thing is, do you apply to community or academic programs? As an IMG, especially as a non-US IMG, I would say prioritize community. 101% prioritize community. Academic programs are too competitive. Uh, Despite a lot of networking, and this is a personal experience, despite a lot of networking, despite a lot of communication, and a lot of showing of interest to a certain academic program, uh, I attended at least 10 of their meetings at 4 a.m. in the morning. I was there in every single one. I was writing emails to the PD. I was writing emails to the APD. Their chief resident followed me on Instagram. Their APD followed me on Instagram. We used to share stories with each other, but they did not offer me an interview despite signaling them. Now, this means that even if you are the most interested application, even if they know you inside out, even if you are a signaled applicant, they will still not prioritize you because they have too many Americans waiting for it, right? So we are a little bottom of the barrel for them. I would definitely say go to the community programs, especially those who have interviewed IMGs in the previous years.
That makes sense. So basically, you prefer community-based programs, and secondly, you prefer the IMGs who got matched from your university or at least from Pakistan, right?
Not just
So
from
let's.
Pakistan. If you start looking into Pakistanis, तो फिर तो गिनती के एक दो प्रोग्राम बचेंगे हमारे. तो उसके लिए आपको थोड़ा सा ज्यादा अपना एम्बिट वाइड करना पड़ता है. Like my program, it has never had a Pakistani or an Indian
Okay.
in it. So you have to take some leaps of faith. I would definitely say that, but community first, not academic.
Makes sense. So let's talk about the interviews now. Okay, let's we applied for the URES. We are waiting for the interview season now. So how many interviews did you get, and how many interviews did you think? Okay, this is something I'm gonna get a shot. I'm gonna get this interview as a sideline that okay, this is something who are going to offer me a position? Do
Hmm.
you know it? Do they give you kind of a clue during the meeting? And before that, how do you prepare for it also? Do you have mock interviews or something like that? Because getting interviews is one thing, and after you get it, you don't want to fumble it at any cost. So how do you make sure you're going to get the best in the interview and making sure that you are being showing that you are the best applicant here? So how did you do that?
I like to flex about this, and this is great because I got 10 interview invites from EM and I got 8 from IM. So I had a total of 18 invites, which was a handful at times. Like November, I think I was giving 2 interviews per week. So I could have practically slept in my suit with a ring light on. And it was difficult, but interviews are very personal to you. Please realize this. And as Pakistanis and as Dowites and as IMGs, I'm telling you this. Don't think of an interview as your CV. आप अपनी CV का कसीदा पढ़ के ना सुनाए किसी को during an interview. They already have it and they're not interested. They want to know you. Don't forget to smile. Don't forget to joke. Don't forget to talk about your life experiences. Connect with them. There were interviews where I was talking to my interviewers about their grandsons. I was talking to them about what car they drive. I was talking to them if they like coffee in a certain way or in a different way. We were talking art influences the world. The program that I matched at, out of the 15-minute interview with my program director, 10 minutes were literally about David's Michelangelo. Oh, sorry, Michelangelo's David in Florence. We were literally talking about how the veins were so realistic and how I really wanted to visit it. So 10 minutes were completely, literally about Florence and Florence only. This shows that you can build a conversation. ER में करना क्या है? ER में करना ही है कि हर ऐरे गैरे नत्थु गैरे के साथ आपको कॉन्वर्सेशन करनी है. जो भी बंदा आपके पास आएगा, चाहे वो पेट का या गन शॉट वोंड के साथ है, आपने उसके साथ बात करनी है. तो बात is the most important. In ER interview, you need to have the communication skill and the ability to make small talk with anyone without it sounding like small talk. So that's very important. In one of the interviews, I was literally talking about Emily in Paris, which is a terrible show, but we can still we can talk about Emily in Paris, and it was a great thing because the program director was as embarrassed about liking Emily in Paris as I was, and both of us were talking about how we both liked the chef a lot in that particular show. So I definitely feel that you need to have a variety of knowledge, and a little bit of ADHD helps in those interviews.
I think ADHD helps to every emergency medicine candidate. You know, you guys have these kind of a thing. It's a joke also because ADHD runs in the
It
veins
helps.
of
I'm sure
most of
Noman
us.
will agree. If we were not ADHD, I think we would be doing what? Dermatology or something like that.
Makes sense. Okay. So that makes you a best candidate. Okay. So let's talk about the backup thing. So did you put IM as a backup because that's very important. If you're studying for the match, let's talk about the dual. I think it's dual match. So did you apply for the dual match? Did you put something in your back of the mind that okay, if I couldn't get matched into EM, I'll go for the IM, or were you like,
Hmm.
no, I'm so enthusiastic for EM, I'll risk everything for it. What was your approach and why stuff like that?
See, this is again personal. I highly recommend dual applying. Highly recommend. The reason why I highly recommend it is EM is unpredictable. मैंने अभी अभी आपको बताया 2021 में 500 से ज्यादा positions were empty. Last year, only 64 positions were empty. So we have had a 90% reduction in EM empty spaces. 90% reduction. It is becoming one of the most competitive specialties across the United States again. So I would highly recommend the EM. If you like it, great, apply, but don't put all your eggs in one basket. Definitely apply to FM or IM as well because there is an overlap, and I would definitely recommend applying to two other as well. If you're someone who likes, not being on the floors and not wanting to specialize in cardiology and gastroenterology, and definitely apply for family medicine. Family medicine is like ER, but a little calm down. You get to see a variety of patients and you get to see them in not in the ER, but in the OPD. So you can apply for that as well. I would 101% recommend dual applying. I dual applied. I had a lot of options, but that was my plan was not to, ye mil gaya to ye mil gaya, wo mil gaya to wo mil gaya. My plan, my goal at the end of the day is going into academics, going into public health, and going into global health. Now, I knew that if I was going through the EM pathway, I could reach there. And I also knew that if I went through the IM pathway, I would also reach there. So I would adjust my pathway, certainly a little bit. Maybe it would be a longer route to reach my end goal, but I knew what my end goal was. So keep an end goal in mind, but definitely dual apply. Even if you're doing IM alone, even if you're doing FM alone, 101% dual apply because it is becoming hard for all of us who need a visa.
Yeah. Okay. Thank you so much for this. I think we are at the end. Lastly, we're gonna think and talk about how do you see this year's math cycle overall. We see NRMP data there because people talk about this is a bit over exaggerated, and we see Dowites getting matched, which is 144 match. There are a lot of data there. How do you personally see this year's math cycle? Was that IMG friendly? Was that not IMG friendly comparing to the previous years? So, can you give your take on it?
I definitely feel it's getting competitive. It's getting heated. Um, Maybe it was a little easier to match 2 years, 3 years ago. Now you have to understand that the post-COVID world is back to normal. You also have to understand that there are positions that are opening up, and more US AMGs, more American medical graduates are now shifting towards lifestyle specialties. Now, when I say lifestyle specialties, I mean IM, I mean EM, I mean FM. पहले उनका होता था भाई करना है न्यूरोसर्जरी. अब उनका भी समझ में आ गया कि नहीं न्यूरोसर्जरी नहीं करना. Let's do EM, let's do IM. So the competition for the traditionally IMG friendly specialties is becoming higher and higher and higher. So if you are a non-visa requiring IMG, sorry, if you are a non US IMG, if you are visa requiring, it is getting heated. It is getting difficult. And I would say prepare for the worst as well. It's all a gamble from this point onwards. You can try to put everything right, but it can go wrong as well. So it's getting heated. My opinion on this math cycle is if you did not dual apply, if you did not have backups, you might suffer later on. So I would definitely say, just maybe 5 to 6 times more competitive than the last few years. This cycle, everyone agrees on this that this cycle was extremely cutthroat and extremely competitive.
That's I think an eye opener because we have to make a plan B also. I think this is what you are saying, right?
Yeah, 100%.
Interesting. Okay, let's. I think we're at the end. I would like to hear what you want to say to the people here in the meeting about any advice you want to give to the students here who are applying for the US and they see, okay, this is the end of the journey, and then you realize, oh, it's a beginning of it. How do you see it being there? Because many people see like, oh, if I got matched, I'll be so happy and stuff like that. Being there, experiencing it, what do you feel? Do you think, okay, this is the end or the start of a new thing, or do you like, oh, it's a part of the process? So, any advice you want to give to the students here apart from medicine, in medicine, or anything in general? We'd love to hear about that also.
Please make sure that you are making the right decisions. Don't make decisions in a hurry. That applies to everything medicine and non-medicine. Uh, Even in life, just because you have a crush on something does not mean you are in love. This applies to your specialties as well. So just because you started to have a crush on a specialty does not mean that it's the best for you. I would say, find out more, make an informed decision, uh, talk to people who are already there, talk to people who are uh, already in the middle of that battle. So just because it seems momentarily attractive or just because it seems cool at one point in time, don't commit to it 100%. Give yourself some space, give yourself some time, and then make a decision.
That's pretty interesting, and I think we have to reflect on it because it's quite deep also.
Yeah.
Thank you so much, Dr. Harsher, for this. Thank you so much, Dr. Harsher, for this. We'll be reconnecting with you in the Q&A session. Meanwhile, I'm going to start with the second segment, which is with Dr. Naman. Dr. Naman, are you there?
Yeah. Am I audible to everyone?
Yeah, you are audible. Thank you so much for agreeing to speak to us, Dr. Naman. It's a huge honor for us. So, without any further delays, let's talk about one on one. We see the segment. We're going to start with the emergency medicine and why EM. So, let's quickly talk about at what moment did you realize, oh, I'm going to do EM and specifically go to the US and pursue EM in the USA. So, two aspects why EM and why USA.
Sure. Hello, everyone. My name is Dr. Naman, and my journey has been quite different from Harsher. Harsher and I, we met on this journey, and I'm happy. Uh, to be honest, before the start of the match season, I was myself really confused how to apply for EM. Harsher was there for me, and Dr. Mariam too, to the mentorship program. But again, my journey has been quite different. I'm a slightly older graduate. I graduated in 2021. When I was in, I never, to be honest, I never wanted to go to the US. I am a big time Chelsea fan. I always wanted to go to UK, and I gave my prep exams too. But then I decided, no, I think I should work a bit more harder and pursue for the United States. So my journey started. I did my house job in AQ. I was lucky enough to get a house job seat in AQ, and over there, my actual passion developed for emergency medicine. I actually made a record in AQ over there. In my 1 year of house job, I actually did 6 months of emergency medicine. That much I love the emergency field. Um, People were like, "How did you do?" Harsher ne bhi ye bola hoga, like, "How, everyone cannot do emergency medicine. You should have the drive, you should have the passion." And mera bhi yahi scene tha. Like when I started emergency medicine, my first month, I was so confused. I didn't know मैं क्या कर रहा हूँ यहाँ. I was literally frozen. And like to be honest, I just had 2 months of EM rotation in my 1 year internship. But like in the end of 1 month, in the of the second month, मुझे इतना ज़्यादा पसंद आया, इतना ज़्यादा पसंद आया. Then and then I decided that this is what I wanted to do. So like I changed with people, and luckily I was able to do 6 months of emergency medicine in my 1 year of house job. And then I developed this passion. Emergency, what different is the different fields that, it's a very common saying in our field. Yeah, we are the we are the jack of all trade but master of none. So हमें सबका we have to know everything about everything, but again, we are master of none. So this is how slowly and steadily I developed my passion for emergency medicine. And again, going into the journey, koi IMGs nahi the. Like we had so less IMGs in EM. It was a very tough journey, and to be honest, we weren't sure कि हम EM में match करेंगे भी नहीं, because कोई past history नहीं है. Just another day, you know, मैं दाव में था, and like people were asking, yeah, why EM? And they were telling, they were asking about different specialty. IM में इतने match हुए हुए, EM में match हुए हुए. When you decided that you wanted to do EM, looking at the NRMP status, क्या इतने IMG match हुए, they were confused. Like कुछ IMGs, like last year also there was about like 140, is be like 140, and from Pakistan उससे भी कम थे. पिछले साल भी like I guess there were 2 to 3 IMGs who matched in EM, and इस साल भी around about 3 to 5 people who matched into IMG. So looking at the past record and seeing people are, if actually you want to go in EM or not, but it's very important, follow your passion. This is what me and Hashid did, and alhamdulillah, we were successful to match in EM.
Yeah, that's pretty great to hear that you took your time and understanding the situation that either you are fit for it or not, and then you give your full to it. So I think crisis understanding things takes time, but you walk through it and you are there. So let's talk about the second aspect, which is pre-residency journey. So can you walk us, because you talked you have taken your lab exams and then you switched to the steps exam and all that stuff. It would be much chaotic, but then you took your time in understanding it and then giving it to the US shot and changing the pathway. So can you please talk about how do you deal with the pressure also? Because I think one thing is the steps, everyone's taking steps and you'll be like, oh, maybe switch ho jata hu and stuff like that. What was your reason? And at what time you're like, okay, I'm sure about this journey. So can you please tell about this thing also? Because there are many people who are going to be in a kind of a situation you were previously.
I totally agree with you. And after being match even अभी भी after being match, because when we were in fourth year fifth year, हम लोग के बैच में इतना रुझान नहीं था like to go for steps and but now seeing the candidates step like fourth year में fifth year में and they have given their step once and two, मुझे टेंशन हो रही थी उनको देख के like how did you guys do it, this is something commendable. And I was appreciating those people like you guys are doing great jobs and तुम लोग you guys are on the right path पे तुम लोग को you're doing everything fine. For me it was very different like my batchmates. मैंने अपना step 1 का एग्जाम दिया भी नहीं था and a lot of my batchmates match and residency कर रहे हैं. Even in Pakistan people like my batchmates like वो लोग R3 हो गए R4 हो गए and I'm over here deciding हाँ मैं भी UK जाऊँ US जाऊँ UK जाऊँ US जाऊँ. So again I was very happy to have a very supportive family who supported my decision when a 360 degree career switch किया था. I'm really happy for that support. But again most importantly हम लोग life is not a race. हर वक्त भागते नहीं रह सकते. कभी किसी के पीछे कभी क्या so everyone has to have their own journey. कुछ लोग पहले मैच करेंगे कुछ लोग बाद में मैच करेंगे. It doesn't matter. The end journey is what it's important.
That's pretty interesting. I think trusting the process and going with the flow sometimes helps also. So I think let's talk about the third aspect, which is about the timeline. So I think we pretty covered that you switched, I think, from PLAB to USMLE, and then you did your steps after graduation. So I think there might people who feel like, oh, I'm too old to go for this pathway, and specialty like EM, so it's like out of the box for me. Can you please talk about studying for the STEP exams after your graduation? How did you manage all of this stuff, and how much time did you take for the both of your exams and the USCs also?
Again I'm over here, you guys are talking about timelines and you guys are talking about like step 1 कब देना है step 2 कब देना है. So again I'm going to repeat the same thing or I'm going to say सबकी journey is going to be different. There is no fixed timeline for anyone. कुछ लोग इस साल के भी we had a spectrum from people from 2005 से भी मैच हुए, from people from 2025. तो कब स्टेप देना है कब यू हैव टू गो फॉर सबके लिए इट्स वेरी डिफरेंट है. हाँ लाइक पीपल अभी दाव में जो लाइक द ट्रेंड इज लाइक पीपल आर गिविंग स्टेप 1 in their fourth year which is really commendable. मैं अपने टाइम फोर्थ ईयर में सोच भी नहीं सकता था कि स्टेप 1 हम फोर्थ ईयर में दे भी सकते हैं and people are doing it and it's commendable. People are getting really good scores too. That's something I would like to appreciate our younger generation from now. But again, जितने जल्दी हो सके स्टेप दो and make up your mind as soon as possible. Yeah, confused हो सकते. People are confused like me. मैं भी confused था. मुझे यूके जाना है, यूएस जाना है. So it's fine. It's part of the journey. It's not a race. सबने कभी ना कभी
How,
मैच करना है.
yeah,
It's
how did
part
you
of the
manage?
process. Yes.
Yeah, how did you manage studying for the STEP exams after graduation? Because I think that's very crucial to manage with a job or with house job. So how did you manage that aspect specifically?
I think like after I graduated मैंने एक ही से job किया था. I was a troll because वो बहुत hectic थी. Then I sat down. What do I want to do abhi? And I'm really really grateful. I had a really supportive family who supported my decision. So after doing my house job, then and there I decided like abhi mujhe steps करना है. So I took time off from working and then I started to study for step 1. And then alhamdulillah I gave my step 1 exam in 2023 and then last year I gave my step 2. Or wo bhi I gave my step 2 like 5 days before the end of like the start of ERAS. So मेरी result आई थी like September 20 में ERAS की application खुलती है and like my result came like 5 to 10 days before that. So I'm lucky enough to actually be part of the match cycle and then match.
Okay, that's great to hear. So I think the house job, you're gonna agree with Dr. Harsher that house job was not a primary focus, but you have to put it as a secondary focus when setting for the math cycle. That don't completely skip it. So do you agree with that aspect also?
It's different for being a younger graduate. You guys, I know it's different for you, but again, your primary focus should be clearing your step one and two. But house job in Pakistan, house job in civil, it's so different. It's so different. No, यहाँ पर तुम्हें हाउस जॉब इफ यू नो सीनियर तुम्हें स्टंट वर्क कराते हैं. सीनियर तुम्हें बोलेंगे मेरे लिए चाय लेके आओ, तो सीनियर तुम्हें बोलेंगे यार इस पेशेंट का ये. सो हाउस जॉब इन पाकिस्तान इज सो डिफरेंट compared to other institute or maybe some some place like AQ too. I did my house job in AQ. Uh, so again, pros to hai. Again, you get your so important clinical experience and in emergency medicine. Above all, Hashir also like mentioned, clinical experience is so important. Like so that if you have ever worked in an emergency setup, I hear questions like, can we do emergency medicine in civil? मैं civil में emergency medicine में गया. It was क्या बोलूँ ये जंगल खाने से कम नहीं था. Everyone is क्योंकि you have so patient load इतने ज्यादा है, patient load इतने ज्यादा है. Everyone is doing जो अपने मर्जी आ रहा है, and you know you don't have any protocol. You don't have any system to follow because patient load ज्यादा है and you don't have मसला ये emergency का कोई system नहीं है पाकिस्तान में. Awareness नहीं है emergency medicine का. You don't have a proper residency training for emergency medicine. Because of that, वो lack of awareness है and lack of proper training है, especially if you're talking about Pakistan. So this is a big con for people who are applying in EM and you know doing house job in such a setup.
Okay, so that makes sense. So let's talk about the real thing, which is the ERAS application. So, what are your tips personally for building an ERAS application? Because as you said earlier, your year of graduation was a bit 2 to 3 years ahead. So, what are your tips when you were applying for the ERAS application? That okay, I'm gonna do these work to overcome those year of graduation valley cheese. So, what are your tips from your experience for ERAS application? I think it switched from ERAS to the new one, but what is medicine now?
Yeah, that was news to me too. मुझे भी नहीं पता था like EM have switched. So I'm so happy that I matched in this season. Again, Iras के लिए it's so important. Hashir के Iras CV would be so different from mine because सबकी journey अलग होती है, सबकी experiences अलग होती है. But it's so important. Like
Yes.
my mentor, Dr. Mariam, जो हमें DMP program से मिली थी, your era TV should be shouting EM, EM, EM. You know, everything should be related to EM. कोई भी specialty हो, they don't want you as a second option. You know, अगर you're applying to internal medicine as a primary and EM as a backup option. Iraq CV में that will be pretty evident, and you know, no specialty wants you as a second option. So keeping that in mind, if you truly are an emergency medicine applicant and you truly do want to do emergency medicine, keep that important. Iraq CV should be shouting EM. You should have paper published in EM. Paper published in EM भी नहीं हो, you know, things that you know things like to again one thing more most important like मेरे पास EM के लिए ये नहीं it's हाशिर यहाँ बैठा हुआ होगा he's gonna laugh about it but हमारे दाव में एक फ्रिप वाली चीज सही है. So like फ्रिप open it's फ्रिप emergency medicine से related है and like फ्रिप की application मुश्किल से 15 मिनट के लिए खुलती थी. मैं हर बार ट्राई करता था. मेरी फ्रिप में आज तक नहीं हुई एंड पीपल यहाँ पर हंस रहे हैं क्या यार हम फ्रिप आज तक नहीं कि हमारी इमरजेंसी मेडिसिन में होगी ना नहीं होगी. एंड देन नाउ आई गेट टू नो क्या फ्रिप ने 15 मिनट से और 5 मिनट कर दिया बिकॉज उन लोग की डिमांड इतनी ज्यादा बढ़ गई. अगेन सबकी सबकी जर्नी अलग होगी एंड यू नो आपने फ्लिप नहीं किया आपका इमरजेंसी में बैच नहीं हो सकता. दैट इज नॉट अ कंसर्न. मैंने आज तक फ्लिप नहीं किया where I used to apply again, लेकिन फ्रिप की उस वक्त डिमांड इतनी अभी भी है ना, लाइक मेरी फ्रिप में नहीं हुई, but still I'm an emergency medicine resident, alhamdulillah I matched. So this was a question like people were coming up, so I thought, but again, Iras, आपकी CV, it should be shouting EM, EM, EM.
That's very interesting. Thank you for sharing it, Dr. Naman, about that FRIP thing. I don't know. Dr. Hasha was going to look into it and increase the time because it was very hard for me. I think I got into the FRIP after second year. So it was quite hard to get into it. So let's talk about the other aspects, which is, can we get to the next slide? Yeah, so let's talk about number of aspects now. Let's talk about what was your step 3. Did you take the step 3 or not?
Am I audible to you guys?
Your research was your particular one for you was the gateway. See which thing helped you a lot. Yeah, you're audible, Dr. Naman.
Okay, like Hashit talked about a lot of
Hello,
things
am I
like
audible?
scores. Yeah, I'm gonna quickly give a recap on what Hashit really said. Like he talked about scores, step 3 research. I think for an visa requiring IMG, for a visa requiring IMG who wants to match an EM, I think connection is the most important. Okay, I think because people in US in EM, they're not ready to sponsor visas. Two, they're not ready to sponsor visa because past history nahi, people don't apply to EM, and a lot of good candidates like EM के बारे में किसी ने कभी सोचा भी नहीं होगा because हमें awareness नहीं, especially in Dow, and we never thought कि हम we can get into this field even. So I think connection is very important, not in just US. You can even connect to people in Pakistan. I had made a lot of EM connection from Pakistan, which translated into US because a lot of our Pakistani emergency consultants are connected to US doctors, and then एक से, you know, your connections grow to. But networking is very important in EM. हमारी EM की एक conference होती है ASAP, which is so important, so important. Although I was in US during my ASAP conference, but due to financial reasons, I couldn't attend. But I try to मैंने ऑनलाइन वाले जो जितने भी थे I try to attend them. But again, connections के बाद personal statement is so important in emergency medicine. Uh, how do they root out a candidate, like if he's an EM candidate or not? You know, people who are in emergency medicine, they have a specific journey. Unki journey is very different from the regular IM or FM. This is what I believe. You know, no one in the right mind would say, हाँ मुझे EM में जाना है. Especially in Pakistan, ये perception है कि EM बहुत stressful है. EM में you have to work a lot. But people who actually work in EM know this is not entirely true. EM itself ये एक अलग नशा है, I would say. People who are in EM would highly agree with me. If EM में उसके passion नहीं होगा, he cannot survive in one day he cannot survive in EM. So like your personal statement should be should be subsidized to emergency medicine, and again connection is very important. Yeah, and if we talk about year of graduation, अभी year of graduation in emergency medicine is not a fixed rule because अभी ज़्यादातर EM applicants are American graduates जो directly apply after applying to school. They apply for or not a lot of IMGs are applying. So अभी कोई fixed trend नहीं है year of graduation पे like IM में क्या like you have to have 3 years or 5 years. ऐसा कुछ fix वो नहीं है. And again, step 3, 4, then research. They're not really important for EM application, but again, it just make you stand out if you do have these.
Makes sense. I think you both agreed upon one thing which I can take away, which is connections and personal statement. Apart from all of these, which is a prerequisite for application, you do it for the sake of doing it, but focus on the aspects. We talk a lot about making connections. Let's talk about how to make connections genuinely, because people come to you and make a connection. You can't go and talk like that. Yes, you can attend a conference, you can write an email, a follow up email, they're going to get back to you. How do you make sure that you are going to form a long term connection with a person enough that they're going to vouch for you, because that's a big thing and that's something you want, but simultaneously want it to be very organically happening. So how do you feel in this whole process you made genuine connections that the people are going to stand up for you and vouch for you for this match cycle also? So what's your take in this?
I'm gonna second Hashir's on the small talk part. Uh, it's so important, especially in emergency medicine. You're gonna spend a lot of time with your fellow emergency physicians, and this is a very important skill, communications. सोचे आपके पास इमरजेंसी में जब मरीज आ रहे होते हैं within 5 to 10 minutes you have to make that small connection. जो physician जो internal medicine वाले they take so much time. आपको वो you hardly have 5 to 10 minutes, and वो 5 to 10 minutes में you have to make that impactful small connection so that you can relate to the patient, you can communicate what they want and what you want to do with them. So that communicative skill is so important in emergency medicine, and that you have to show in your interview session. मुझे लोग बोलते थे like me I'm मैं इतना serious नहीं हूँ, especially like when talking about interview. People were like, especially IM candidates, don't make jokes around your PT. Don't always keep smiling, and because ever since I've transacted from medical school to my clinical career, my clinical orientation has always been EM. So जब भी मैं काम कर रहा होता हूँ, my orientation has always been EM per pursue, like how an EM physician would treat a patient. Whether I'm working in an OPD setup or I'm working in a clinical setup, generally my clinical orientation EM की तरफ ही जाता है. So in that short time, it's very important. You make that important connection.
Yeah, that's pretty interesting, because I think it comes back to the personality also, because you and Dr. Harsher both said one thing is a sense of humor to connect with the person and be who you are at the end of the day. So let's talk about the LORs for emergency medicine. Can you please talk a bit about SLOEs also? How many SLOEs did you get, and what was for you LORs for emergency medicine looks like?
So like, I'm going to say this right off. To get an interview in EM, slow is a must, 100%. I got a program director, a good program director from New York, emailing me. You are a very good candidate. You have experience in emergency medicine, but we are not going to give you an interview because you don't have a slow. Although I thought I had a slow because I worked in an emergency medicine in emergency setup in US. So then only I get to know that slow is, if you're doing an observership, you cannot get a slow. In an observership, which normally we guys do after we graduate, in observership you cannot get a slow, because slow is they judge you when you're hands-on with the patient, and you do a lot of procedures in EM. So in an observership, you cannot get a proper slow because you're not hands-on with the patient. You're not doing the all important emergency procedures in the EM. So this is what I got to know during my interview season, because I worked with an EM physician and in US, and back of the mind I was like, I have one slow. But during my journey, when the program director messaged me, like, no, you don't have a slow, and we cannot offer you an interview because of that. We put a lot of weight on slow. So this was something an eye opener for me and for future EM applicants. If you're interested in EM, when you're in your fifth year, your fourth year medical student, if you do get a chance to go to US, do experience getting an EM elective and getting in flow. It's very important for EM applicants.
Yeah, so we can say for sure we need a slow at least one if we want to sit for the emergency medicine match. So it's like a compulsory thing, right?
Exactly.
So, so let's see the other aspects, which is I think the approach to the application and program signaling. So, how did you funnel down the things when you were applying for the hospitals? Did you prefer the geographical location also? Because I think some people say, okay, this is a location I'm gonna prefer. Or when it comes to IMG, you be like, okay, just apply to the people. Where do you know the geographical location comes secondary to it because we can't pick and choose right now. So, what was your signaling thing, and what was your application procedure while we are applying for the hospitals? Looks like.
Again, to summarize it in our language, अपने औकात में रह के सिग्नलिंग करनी चाहिए. It's so important. हमें चाहिए. We all want कि हम we signal those big programs, and we expect कि हमें interviews आएंगी. This is not the case. This is not the case. Again, as a person, as a Karachiite, I wanted to always live in New York. I see the bustling city. I I couldn't imagine myself working in an environment like जहाँ पर you hardly see people, but when you come to US, वो perspective change होता है. Like Hashim mentioned, getting a signaling to a university program जहाँ पर a lot of AMGs, proper EM candidates, and are going to apply. Being a visa requiring candidate, this puts us down, really down, because EM programs do not sponsor visas. क्योंकि a lot of reasons, administrative reasons, they're not used to seeing IMGs in EM. And besides that, whatsoever reasons, EM programs do not sponsor visas. This is a very big pitfall for EM applicants for IMG. So it's very important signal programs which do have IMG, but again, IMGs already they come in. So your networking and your connections come in handy then. Signal programs which you believe you have some even before, like me and Hashir, I remember we were attending so many open houses. He was messaging me क्या हाँ आज यहाँ पर open house attend ये करना है. Bichara Hashir was in Pakistan and he was attending those at 4 a.m., 5 a.m. over there. Alhamdulillah, I was in US, but still we did not miss any open house. Any open house we did not miss. And we at least we get to show our faces to the program director. Yeah, we are interested and we are here for you guys. So it's very important that you make those connections then and then you signal them accordingly.
Is Amna there, Huda? Or yeah, I think she's
Yeah,
back.
Hello.
yeah,
I'm
yeah.
really sorry. I think my internet was a bit lagging. So you were talking about waking up at 4 a.m. and attending the meeting and showing up, right? This is the last thing I was hearing, right?
Yeah, that's true.
Yeah. So I think we pretty hear a lot about the steps or the easiest part. I think hearing from you and Dr. Harsher, I'm gonna agree that steps will be the easiest part. The things and the journey begins after it, right?
That's true. I totally agree with you.
Hmm.
Steps to सब कर लेंगे.
Okay.
Step one, step two,
Hopefully,
सब कर लेंगे. Again, making the connection and networking, that is very important.
yeah. So getting breakdowns during step one is such a normal thing. So I'm gonna be really
Yeah, I'm not
yeah.
trying to scare you, but there are steeper stairs
Hmm.
ahead.
Hmm. Okay, let's talk about the other aspect, which is IM as a backup. So, Dr. Naman, did you place IM as a backup too? Okay, let's talk about the interview skills. Do you want to do the interview skills first? We talked
So
about
I
signal
think
strategy. Let's talk about interview skills. So, I think, Dr. Naman, we're going to talk about any specific interview skill that you find because, okay, not everyone is very good at sense of humor and cracking jokes. They don't feel very comfortable when it comes to that aspect. Also, some people have very serious personalities. So, how do you make sure you are being the best version of yourself in the interview and simultaneously gauging the interest of the applicant and the host also? So, what you would doing in your interviews to make sure that you are being the real version of yourself?
if 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 I'm talking about my journey specifically, you know, uh, जो लोग emergency medicine में who are passionate about them, if you make them talk about emergency medicine, they can go on and on with it, on and on with it. That was the case with me and Hashir. We were really comfortable in our skin because this is what we wanted to do. Or if during the process, हमारे पास in emergency, if you're working in an emergency department, हमारे पास, you have a very बहुत कम time होता है to connect with people, so you have to build that rapport with the PD, with the resident in a very short time. So this is a skill you should have in if you're applying to emergency medicine. मेरे IM के interviews में I did get IM to interviews में, and when they're talking about why you want to do IM, मेरे दिमाग में EM जीत रहा है. I'm like I cannot answer this because I never wanted to do IM because I cannot see myself working as an internal physician or cardiologist, any of those related field. मेरे IM के interview में I'm thinking I prepared everything what I want to, मुझे क्या बोलना है क्या नहीं बोलना है, but still मेरे दिमाग में EM चले because my brain is fixed into emergency medicine. और उस दौरान ही like उसको भी the program director भी, he had my CV, he know I'm a primary EM candidate. उसको भी पता होगा क्या this guy is an EM physician and कुछ भी करके he's going back to emergency medicine and he's not an IM candidate. So this is very important. I know I've made this mistake. Yeah, it's very important. It's very important. Yeah, uh, whichever field you're applying to, you should be. हम पाकिस्तानियों, टू बी ऑनेस्ट, हम पाकिस्तानियों के पास ऑप्शन भी नहीं है. हमने तो जो भी मिल जाए हम लोग उसके लिए तैयार हैं. So but in people in US, no one wants to have a second option. Whatever field, IMO, FMO, psychiatry, no one wants them as a second option. So like during interview, if you're giving an IM applicant, if you're being an FM applicant, you should be true to that field and that should resonate. Yeah, by ye banda, he does want to do FM, he does want to do IM. It's very important.
So yeah, I think you need to be sure before applying that this is something I want to do and make sure you're gonna sell yourself in the AM. That's very important. So let's talk about few more slides I think we have left. Let's dual applying. I think you also applied dual. We talked earlier that IM and EM both were in your application, but you talked about EM a lot and that was helping you and not helping you in the same way, right?
I agree with you.
Okay, so I think there are two more things we're gonna talk about. I think
As
yeah.
yeah, no, as a matter of fact, like I knew I did not want to do IM. I had Ashir and Dr. Mariam with me on my journey, and they were like, "You have to apply in IM." So IM was not actually my backup option. It was I did apply in IM. I did also apply in anesthesia and FM. That was my backup option. I did get interview from that too, but in the end, I'm happy that I matched
Mm-hmm.
into the field I wanted to.
You have to think a lot because when you're not getting your first priority, then things get trouble a bit. So,
I agree.
so let's talk about what were your, you know, yeah. So, what is your overall thought on the 2025 math cycle? So, you're gonna see I think your batch, which is people getting matched into IM, FM, and competitive specialty that you matched. How do you see personally this year's match cycle? Do you think EM is now become more competitive, or do you see like okay, now
Hello, Amna,
Yeah.
are you there?
Am I audible?
Yeah, you are. I guess Amna's internet is lagging.
Should I start?
Did you hear the question?
Yeah,
I think
yeah,
it's
I
about
got
the
it.
math cycle, right? Yeah.
Yeah,
Yeah.
it is.
hope happening for the
So I think I'll start. So the so the thing with this match cycle, I know like हर जगह आ रहा है कि 1,000 Pakistanis have matched, but the truth is कि applicants भी बहुत ज़्यादा बढ़ चुके हैं. If you see this, कि applicants अगर if last time अगर like I know this is a very rough number, like if 5,000 Pakistani applicants were applying, पिछले साल this time the number double or maybe more than 10,000. Pakistan की ऐसी हालत हो गई है. Everyone just wants to leave the country. So I've seen so many people are interested in doing steps now. So the number have, although ये number this you see क्या 1,000 Pakistanis have met, but what this is, I believe क्या this is a false number, and like ये नहीं है क्या Pakistanis have become much better. Yep, more people are the because आप देखा जाए तो वो IMGs के ratio से nearly same ही है, like 60% or 58%, something around that line. So the number, if you guys are seeing that, is I believe that is that not actually because the applicant के number बहुत ज़्यादा बढ़ गए हैं. All the fields have become very competitive. There are a lot of candidates applying and a lot of good candidates too. And not everyone can be as good. सबके पास research paper नहीं हो सकते. सबके पास good step scores नहीं हो सकते. The most important thing is you have to step out. You have to you 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 have to step out, and stepping out, your personal statement, your connection is so important. This is how you can match through your cycle, because the competition is increasing day by day, and the number of applicants is also increasing. You have to find your niche.
yeah, it's not getting, yeah, it's just not getting easier anyway, you know. Hello, I think there is internet issue from my end. Dr. Man, can you hear me?
Yeah, I can hear you now.
Give me a second. I'm gonna
Yeah, sure, sure,
switch to another hotspot right now. I'm gonna connect with the 4G.
sure, sure.
Mm, okay. Just give me a second. Let me switch. Hello.
Hello. Yeah, you're audible now.
Yeah. I'm really sorry. I think there's internet issues going on from my end. Apologies for that. I think
Amna, Amna, do you want
we are
one
just
of
going
us
to end the
to go
session. I
ahead?
have one last talked and stressed a lot about the steps, the research to all the people around you. Yeah. Yeah, please. Harsha, can you please wrap it up for someone
Yeah, sure.
because my internet is lagging a lot.
No problem, no problem.
Go ahead.
So, Numan, I think I'll ask the last question. What do advice do you have for all of us? Not for me, hopefully, but for all of us.
आपके सामने issues से issue आ रहे हैं. Being a Pakistani, you have a lot of issues. सबसे important during your interview season, please have a good internet connection. This is so important. And during our time, we had strikes in Pakistan. We had huge issue like we were gonna have during interview season. हमारे internet, we weren't sure that if we were able to do if we were able to smoothly give our interview. So again, advice आपके सामने ही आ गई the problem. And again, most importantly for students, follow your passion. Yeah, it's very important. Yeah, whatever field you decided to go, it's very important that students follow the passion instead of following the crowd.
I think that wraps up the and now we have question and answers, right? So, Huda, do we take questions in the chat box?
Yeah. Let me see.
I've tried to answer some of them, but if there are any questions anyone else wants to ask, this is like a freestanding thing now, so both of us can answer.
Yeah. Any of the participants that needs to ask a question?
A pretty small room, so we can, even take unmuting and we can talk.
अभी तो फिलहाल कोई क्वेश्चन नहीं है. अच्छा.
I think Noman would be able to answer that best.
Okay, so like there was this question from Rohar about networking. So again, if you have done your internship in AQ, you must know all the consultant, Dr. Shan, Dr. Fareed. As a matter of fact, I'm gonna tell you something. Dow की जो MSP जो letter हमें मिलती है, I know that is so generic. I decided not to use it. I actually decided not to use it because I believe it's gonna do me no good than harm. So as a matter of fact, AQ के program director Dr. Shahan Wahid, he wrote me a letter of recommendation which I used in my EM application, and it's because I've worked 6 months with them, and उसके बाद भी I was connected with them. They were able to write a very personalized letter because they've actually worked with him. I actually did my first central line under his guidance, and I did a lot of procedures with him. So he was able to write those procedures, and EM procedures are very important, and those personalized LORs way more important जो दाव का CPC की जो सबको एक ही लेटर छाप के देती है. So I think if you have the opportunity to do your internship, you should be connected with the emergency department. I'm still connected with a lot of my seniors. They have moved all around the world, but they're still connected with me. So it's very important you get letters from people who you actually work with.
There's another question from Zinera about UCSC.
Zunera Peds EM is definitely an option. So if you can do emergency medicine, after emergency medicine, you can even do a Peds EM fellowship, which will allow you to focus on Peds emergency only. And that is a very coveted specialty. It's a very difficult specialty. Plus, it gets paid a lot compared to a normal EM attending, because you can then work at a children's hospital. You can work at a infant or NICU holding place as well. Like my particular hospital, it's a level 2 adult trauma center, but it's a level 3 pediatric center. So we don't have a PEDS EM fellow with us, but level 2 and onwards do have a PEDS EM fellow. So if you're someone who wants to combine these two, you can even do PEDS EM, and you can get experiences accordingly. You can talk to pediatric EM attendings. We have quite a few who are working very, very tirelessly in this field. So that is one way you can combine them. But if you want to keep them separate, if you want to keep them discrete, then I would advise doing rotations in both, in pediatrics and in EM. And then when you are putting them in your CV and you get asked about it, you can definitely say that one of the niches within EM that you want to do is pediatrics. That will be well received, and people do understand that. Noman, what do you think makes a candidate truly stand out?
I think I've talked about this a lot आज के ज़माने में सबके पास गुड स्टेप्स स्कोर्स हैं, सबके पास गुड स्टेप टू स्कोर्स हैं, एवरीवन इज डूइंग रिसर्च, एवरीवन इज डूइंग ये volunteer. What really makes you stand out is your personality and your backstory. ये सबकी अलग है. So that's why your personal statement is so important, so important. It should be personalized, and दूसरों, it's very important कि how you present yourself. हम सब दाव के graduates हैं, we are all very good students. हम सब ने observerships किए होंगे, and everyone कुछ ना कुछ किया. But I think in this day and age, your personality and your unique story. Everyone has a very unique story on how they got into this field or how they really made it to US. कुछ के लिए it must be कुछ के लिए financially बहुत इशू होगा, कुछ के लिए family support नहीं होगा, कुछ के लिए emotionally. This is something they want to connect with us. So being unique, standing out in your CV is so important. ऐसा कुछ, I know it's not easy सबके लिए, but कुछ भी, anything which makes you stand out is very important, very important in this day, because UAC steps course तो सबके पास अभी हो रहे हैं, and research, everything सबके पास हो रहा है, but your personality, your communication skills, how you present yourself, this is so important.
Yeah, the way you talk, I think that matters a lot. Um, the way you present yourself, it has to be very, very, very original. It has to be very, very personal. आप नहीं कर सकते, मेरा नहीं ख्याल कि आप फेक कर सकते हैं, especially US के लोगों के सामने. Especially US PDs are so experienced. They will look at you if you're being fake. They'll look at you if you're lying, and they'll know it in a heartbeat. They won't even tell you on your face that they know, but they just won't rank you, or they just won't invite you for an interview, खुदा ना खास्ता. So I would definitely recommend, being very original with yourself. Don't lie. And during this process, just if you're genuinely kind, if you're genuinely interested, if you're genuinely hardworking, that will make you stand out. Don't look for, a unicorn thing in your application कि नहीं मुझे एक ही ऐसी चीज चाहिए जो shine out करेगी. Everything together looks very pretty. That was what my personal statement was about. एक कॉन्सेप्ट है इटली में जिसको कहते हैं बेल कंपोस्टो. बेल का मतलब होता है ब्यूटीफुल और कंपोस्टो का मतलब होता है कॉम्पोजिशन. कि अगर आप एक कॉम्पोजिशन जब एक टोटल बन जाती है तो वो साथ प्यारी ही लगती है, अलग अलग करेंगे तो वो गलत लगेगी.
हाशिर
Uh,
अभी बहुत हाशिर अभी बहुत humble हो रहा है, but he also knows, and everyone knows क्या Hashir की unique debate style, his unique perspective of storytelling, that is what made him stand out. Everyone, किसी ना किसी के कुछ ना कुछ talent होते हैं. For him, it must be pretty normal. For us, people who listening to him for the very first time, it does stand out. ऐसे traits हैं which makes you stand out, and this is what really makes you apart.
and Noman's kindness is on display right now. So that also uh, helps a lot. In interviews, genuinely it helps. अगर आप किसी की तारीफ कर सकते हैं मतलब आप अच्छे इंसान हैं. And it does help. In resident sessions, देखो, interview is not just meeting the PD or meeting the chief resident or meeting the attendings. It's also meeting residents. It's also meeting your cohort together. Social events होते हैं. उसमें आप किस तरह बिहेव करते हैं, किसी को अप्रिशिएट करते हैं, किसी का कुत्ते बिल्ली को देख के उसकी तारीफ करते हैं. तो ये वाली चीज भी बहुत मैटर करती है. हालांकि मुझे कोई इंटरेस्ट नहीं है किसी की बिल्ली में, लेकिन थोड़ा सा यू हैव टू शो feign interest, if that's the word. um Based on a current, there was one more question from Roha. Roha, EM experience. Noman ka, I think AKU ka experience helped a lot. I think my experience in the US helped a lot. Even in ENT, in Dow, in civil, I used to work a lot in the ER. I used to stitch up people on a daily basis. So that did help a lot. So I would say EM related experience. Go to anesthesia, ask them if they can let you intubate, talk about how the vent works, talk about how epi works. So all of these things do help a lot. बाकी जो दो चीजें मैंने ऊपर ऐड की थी, साइम एंड एसेप, अगर आपके पास इनफ फंड्स हैं तो प्लीज इनको ज्वाइन करें. आस्क देम फॉर अ डिस्काउंट, आस्क देम फॉर अ स्टूडेंट डिस्काउंट. आपको शायद मिल भी जाए. It's a good investment. And then, as Noman and I, we both attended open houses regularly. So this is very important. Like starting early is very important. Don't wait for.
रियल लाइफ एग्जांपल, एनेस्थीसिया वाले के पास जाके नहीं बोलना कि आप मुझे इंट्यूबेशन सिखाओ, मुझे इमरजेंसी मेडिसिन करना है, उसी वक्त निकाल
हाँ,
देंगे तुम्हें.
हाँ. Just tell them you're interested in airway and you wanna do this. मुझे बैग
Yeah,
करना सिखाएं, मुझे बैग नहीं आता करना. तो बैग करना हालांकि इतना आसान लगता है कि बस एक पकड़ के दबाना है, लेकिन बैग करना भी एक स्किल है. तो वो भी आप
that's
थोड़ा
true.
आप हाथ में बहुत दर्द होता है उसमें. So this is my attending used to say, if your wrist isn't hurting, you're not ventilating right. So, and that is true. That is 100% true. Based on your current experience, how important in local air to add value apart from being a conversation with someone is playing? Noman, what do you think? I really don't think local electives are super important. I would say be clinically active, but don't pay for, anything local. अगर मिल रहा है ऐसे चलते फिरते तो sure.
To be honest, any experience in emergency medicine which you can talk about is important. People who are actually in the field, who actually did something, can only talk about. तुम किसी इंटरनल मेडिसिन के कैंडिडेट को ईएम इंटरव्यू में खड़ा कर दो, आई डोंट थिंक सो he can really make a difference. So I think any experience, I know local elective, it doesn't count a lot, but this is something which you can talk about. If something again, something is better than nothing, because
Hmm.
getting an elective in US is in emergency medicine itself is very hard. So for me, I would highly suggest something is better than nothing.
Shanze has asked a question, and Shanze, although it has come to me as a direct message, do you mind if I answer it openly? Yeah. So Shanz is asking that most US EDs have a policy that they don't take IMGs and they don't offer electives to IMGs. I think that is 50% true and 50% false. 50% false isliye because just because no one is applying does not mean no one will get in. So I would definitely think that you should be applying. Noman and I were both told, I'm pretty sure both of us were advised against applying EM, and we were told कि नहीं करो, किसी का होता ही नहीं है. भाई किसी ने किया ही नहीं है तो होगा कैसे? करके देखें तो होगा. तो इस तरह से हमने भी कोशिश की. अब ठीक है, हो सकता था कि हम में से नुमान मैच हो जाता, मैं मैच नहीं होता, या मैं मैच हो जाता, नुमान मैच नहीं होता. बट वी हैव टू ट्राई, राइट? वी हैव टू कवर आवर ग्राउंड. ऐसा नहीं है दैट यू शुड ओनली अप्लाई टू वन थिंग एंड बी लाइक ओके लेजर फोकस नथिंग एल्स. You should have your safety parameters, but don't let your passion go and don't be scared from applying. टॉक टू पीपल, टॉक टू देम. आपकी पॉलिसी है, नहीं है, नहीं है, ठीक है, वेरी गुड, आई विल अप्लाई. अगर आपकी पॉलिसी है, ठीक है, उसको अप्लाई ना करें. You have to email people, have to get out of your comfort zone, have to email the program coordinators and to ask them, I am an IMG from Dar Medical College, I am in final year, I have done this, and I really want to do EM. Can I come to you and do an elective? What can they say? They can say no, or they can say yes, apply. If they say yes, apply, please apply. डोंट बी स्केर्ड कि किसी का हुआ नहीं है तो हमारा भी नहीं होगा. आप करें, कोशिश करें, कदम बढ़ाएं, हो सकता है हो जाए.
I think I second what this Ashish said. Like if you are applying to in, अगर आप 10 जगह 20 जगह apply कर रहे हैं, 18 19 are going to say no to you, but that one who
Hmm,
says yes, that's gonna make the difference.
you have to try.
Yeah.
Any other questions? Roha,
I,
yeah, I'm so glad Roha understands that it hurts so much. It used to hurt quite a bit.
I guess we are done with questions, right? Yeah,
Um, yeah, I think so. I
yeah.
will
So
just drop my email in the chat box. So if anyone else wants to connect or just ask a question that they're not comfortable right now, that is my email. I will definitely try to
there's
answer.
another question.
Uh, that's Ahila, that's 200% fine. If you don't explore, if you don't eat sushi, you're never going to know if you like it or don't like it, right? So you have to try out different things, and you will like something and you'll spit out the rest, which is fine. एज अ मेडिकल स्टूडेंट यू आर अलाउड टू एक्सपेरिमेंट। आप मेडिकल स्टूडेंट का पॉइंट ही ये है कि आप डिफरेंट डिफरेंट जगहों पे जाएं और अपना नीश ढूंढें। मैंने आपको बताया कि मुझे सर्जरी पसंद थी, लेकिन मुझे सर्जरी का लाइफस्टाइल पसंद नहीं था। हाउ डिड आई इवन गेट टू नो द लाइफस्टाइल? बाय लुकिंग एट देम, राइट? बाय टॉकिंग टू देम, बाय डूइंग इट। सो if you have done your research projects in cardiology, neurology, that's completely fine, 100% fine. You can still meander into other things. Just don't make your application look like a bouquet of everything. As long as you are trying to make it somehow focus towards one thing, that's perfectly fine. And honestly, not liking one field too much may also be a sign that you want to be in a field that deals with everything, which is emergency medicine or family medicine. And that is a good marker as well. मुझे पता था मुझे कार्डियोलॉजी से मोहब्बत नहीं है, लेकिन मुझे कार्डियोलॉजी से नफरत भी नहीं है. So I would want to see a patient once in a while, but not every day. ER lets me do that. Family medicine will let you do that. So you can even go for stuff like that.
Dr. Naman, there is a question for you from Doha. So, is there any way
Yeah.
that they can contact you, like an email or something? Okay, I guess that's it. Let's end the session here. Thank you so much, Dr. Rohan and Dr. Naman, for joining us today. And it was truly an honor that you guys are uh, taking time out for us and attending this webinar and giving an insight of your journey and sharing your experiences to help us. And you guys were talking about standing out thing. I believe that you guys stand out the most because getting into emergency medicine is itself a big deal because it has really less chances to get into. So a big congratulations to both of you. You truly admire us being a Dawite. So thank you so much. It was a privilege